Oversight visit. Today he's in the Nelson Mandela Bay Metro in the Eastern Cape. This is the epicentre of COVID-19 infections in the province. There are more than 100 positive cases with 2 deaths. The minister will oversee the setting up of a field hospital and later travel to the Livingstone Hospital, which is a designated quarantine facility. We cross now live to SABC reporter Lerato Fekisi. She's in Port Elizabeth. Lerato, a very good morning to you. What can you tell us about the minister's activities there today?
A very good morning to you too. Right now we are broadcasting live outside a field hospital, which is a building that you see behind me, which has been donated by VW. Now this specific building is going to be a field hospital, like I said, that is able to cater to 3,100 patients. So it can take about 3,100 beds, and it will be an overflow of positive COVID-19 patients only. Overflow from local hospitals like Livingstone Hospital and also Doranginza Hospital as well. We also have been told that this specific hospital will take patients that can use oxygen and those that can't as well, but will not cater to patients that use ICU facilities. So if a patient is ICU critical, they will not be catered here. But let's just come inside a bit and just take a look briefly as to how exactly this hospital will look inside. So this is one of the field hospitals, one of many field hospitals that have been set up here in PE, that will obviously house patients that are positive with the virus. But I want to just show you a prototype of how a specific ward or specific room is going to look like once exactly we have these patients in. Obviously right now what you see in the picture right now is a prototype bed. It's not exactly the bed that will be utilized. VW has said they want to make sure they obviously give high standard beds and high quality beds. But what you see now obviously is what a typical station would look like. There'll obviously be linen sheets, towels, and every single patient will be quarantined alone because obviously they have the virus. But just speaking earlier on to VW, they said that obviously critical to this this building being used as a field hospital will be to make sure that enough financing is given to them to make sure this becomes a reality. But also a critical fact here in Eastern Cape has been the issue of staffing. Earlier on, about 2 months ago, the Premier said that there will be 2,500 unemployed nurses that will be trained again to come and work in such hospitals. But then you have to ask yourself, in a province right now which has got a shortage of staff, there hasn't been also a way forward to here. Have these staff been called up already? Do we have enough personnel? It's all good and well to have field stations which can host 3,100 beds, but do we have the staff capabilities? Do we have enough nurses, enough doctors to come and oversee the patients who will be positive at these venues as well? So the minister will be here in a few minutes' time. He's still at a media briefing in Summerstrand, but we want to hear from him exactly that how far are they with finalizing the specific field station, because we hear that it's still in the pipeline, not yet confirmed. But also want to find out for him just in terms of personnel. Is the Eastern Cape, do we have enough staff personnel who are able to be on the front line and assist with the patients that are obviously going to be deployed to this field station?
Lerato, just while we have you, a sense of the small area where you are, where you are driving in into the hospital, are you getting a sense that people are observing the protocols required for this lockdown as we head towards the anticipated end of the lockdown?
I think when we drove this morning, we drove past pretty much the CBD of Nelson Mandela Bay, and I will honestly say that the streets were empty. There was not one person in sight, obviously because the shops are still closed. But when I posted earlier on that I'm going to be covering the minister on my Facebook page, people said, please can you ask him to come to the townships such as Dwesi, Motherwell, Zwide, Magaki, where people are going on as business as usual, which is quite concerning because these are areas specifically like Dwesi, which is currently sitting at over 20 people who are infected. So if the people in that area are still not complying to social distancing, still going out as business as usual, you then ask yourself, when this lockdown ends, how bad will things be when already in an area which has got positive COVID-19 patients, people are still going about as business as usual?
Thank you so much for talking to us, Lerato. Of course, we'll cover the minister's visit as soon as he is there and the activities that he will undergo today.